My dear undergraduate students, I am now taking you to Neoplasia 3. In this one, you shall be finding that the following subheadings are being covered. Precancerous lesions. I have given you a tabular column. Bowen's disease, for example, Marjolin's ulcer, leukoplakia, etc. That one you people will have to write. It can come as MCQs also. Secondly, the word precancerous includes dysplasia as well as carcinoma in situ. What is the definition of dysplasia? What is the definition of carcinoma in situ? Both are relatively same. Carcinoma in situ will include the entire thickness of it. So how do you grade it? A beautiful line diagram is given. I would like you people to mention. And what are all the cytological features? Variation in size, shape, nucleus, hyperchromaticity. Find out if all these are there. You will have to write this in your exam. There is another thing called as paraneoplastic syndrome. Paraneoplastic means they are clinical manifestations. And I given a beautiful tabular column. Your Robbins also gives, Tips book also gives. And I would like you people to go through the clinical syndrome, the neoplasia, and what are all the agents which are causing it. See whether you are able to find this tabular column. Otherwise, this answer is a waste. Cushing syndrome, ACTH, etc. And there can be acanthosis nigricans in the case of gastric carcinoma. And what is the mechanism? So I would like you people to kindly mention all this. And another one will be the staging of the cancer. Though this is not extremely important, you people will have to know what are the different stages. That is given in the form of a diagram. I would like you people to write it. When the lymph nodes are involved, when the distant nodes are involved, or when there is bone marrow involvement. What are all the various stages? And how do you diagnose cancer? Regarding the diagnosis of cancer, I would like you people to write many things. It is again given in my book as well as elsewhere, but definitely my book tips and the class in R.A.T.S will be extremely useful. You are supposed to mention the histological diagnosis, the cytological diagnosis. In that again, you will be having FNAC as well as exfoliative cytology. Please mark these words. They are independent questions. Fine needle aspiration cytology and exfoliative cytology. They are important questions and I have explained them vividly with the line diagrams. Also, there are the various other things such as the immunohistochemistry, frozen section. What are the special states? Mark all this and read it. In case this comes as an essay question, we should be able to write it. That brings us to the end of the class over here, but let me complete it. So here again, there are the tumor markers, exfoliative cytology and FNAC. I have explained it separately. So exfoliation means falling off, the pap smear, etc. Again, what are all the sites? What are the stains? What is the importance? FNAC, where all can we do fine needle aspiration? What is the advantage? What is the disadvantage? Repeatedly asked university question. Immunohistochemistry also has been marked, so I would like you people to see. And tumor markers is a question, both of them. Tumor markers means what are the substances which are being produced. Your books give a tabular column on tumor markers. Alpha fetoprotein, for example, carcinoembryonic antigen. All that you will have to write. And immunohistochemistry, there is a list of some important markers which are used in diagnosis. Prostate specific antigen, or you find estrogen receptor, progesterone receptor in breast cancer. That particular one you people will have to read. So the lab diagnosis of cancer is an extremely important one. The previous picture as well as this you people will have to write. That brings us to the end of this class.